Bismillahirrahmanirrahim. Assalamu alaikum. Thank you, Dr. Zishan, for the kind introduction. Thanks, Dr. Maksood and Dr. Dogar, for being here and all the participants for being here. It's an important topic. I think we really want to spend some time on it, understanding the disease of addiction so we can help our communities. The way we have divided the talk is that I'll go over the concept of the disease of addiction and talk about some risk factors, protective factors, how we can address it. And then Dr. Farah Basi will talk about the role of faith and then other coping skills and how we can help our community. So just one disclosure that I have that's relevant to this is I'm a prescriber consultant for Substance Abuse and Mental Health Services Administration. So just a little bit on the prevalence, just to see how big of this is an issue in the world. About 269 million people use opioids worldwide in 2018. That was the UNODC report. And 27 million reported using illegal drugs, abusing prescription drugs. 66 million reported binge drinking for alcohol. And the amount that's spent every year is around like $500 billion to treat alcohol and drug problems. In Pakistan, if you look at it, this is a piece that was done by Dr. Majibeen Islam. And in her research, she found out in per capita terms, Pakistan was reported to be the most heroin addicted country in the world. And now you probably have heard about the rising rates of methamphetamine, which they normally call ice. So that's been rising. The heroin has always been there, and then marijuana problems. And they are very common, like even in the schools, if you know some people over there and you ask them, kids would tell you that these things are available on the campuses. So that's the issue that we are trying to tackle. What is the economic impact of the drugs? The first thing is whoever is using the drugs, they have to buy the drugs. They have to come up with the money to buy a drug. So how do they come up with the money? So whatever they have, their savings, they use up that. Then they go to their family members, their friends, they ask for money from them. Then if they cannot find it, then they will start stealing money. They have to come up with that to feed this disease of addiction. So that's one issue. Then whoever is using the drugs is not part of your workforce. So they're not adding to the productivity of the country. Then there are healthcare issues. So for example, if they're using alcohol, they can have liver problems. If they're using other drugs, like say they're using IV drugs, they can have heart issues. They can throw some embolus to the heart. So there are multiple issues that can happen from using drugs. And then there are legal issues. So if they have the drug and in either they are intoxicated when they've used the drug, they can commit crimes, or if they are caught with the drug, then they can be sent to jail and they can serve the time over there. And then if they come out, they have to pay court fees and drug-related fines. And then there's cost of addiction on the society. So if there's a segment of the society that's using drugs, consuming all the resources, including the healthcare resources, going to the hospitals, rehabs, then consuming the law enforcement resources, and they are not adding anything to the economy, they're not working, all that burden has to be taken by the society in the end. And then criminality goes up if people are using drugs, because again, either they do criminal acts while they're intoxicated, or they do it to get the drugs and to get money for that. So I always, in any talk that I do, I include this slide, which is addiction, a moral illness. And I think that's the most important thing that we can help educate people about. The concept has always been that anyone who is using drugs is somehow has a lower morality, or they have a characterological flaw. So they're using drugs because they are not a strong person, और जिस तरह हमारी सोसाइटी में कहते हैं कि एक बुरा इंसान है, इसलिए वो इस नशे की लत में लगा है. So that is the point that I think we all need to understand. When we look at all the studies and we look at all the research, it's not a moral illness. It's actually, it behaves like any other medical illness. If you look at the course of hypertension, you look at the course of diabetes, the same relapsing, remitting kind of pattern. If you look at the brain anatomy, when people are using the drug, there are areas of the brain that are affected. When you stop using the drug, those areas recover. So it kind of follows the same pattern. So unless we start treating it as a medical problem in the society, we will always have this barrier where patients who are using drugs, they will feel ashamed to come forward to seek treatment. Parents who know that their kids are using drugs, they will feel ashamed to bring them forward for the treatment. Similarly, you go to any school, any college, and ask them, how many kids in your school use drugs? Nobody would tell you because it's a bad press for the school. But in reality, it is very common on the campuses. And the problem is the stigma. But if you go and ask them, hey, we don't want to know who has it, but can you do a survey and find out how many of your kids have maybe ADHD, or that still has some stigma with a mental illness, but just like hypertension or any other disease, you probably will get a really good turnout and people will say, yeah, I'm suffering from this. But when you talk about mental illnesses and addiction, then people don't want to share that. And I think that's coming from the one of the factors is that we see it as a characterological flaw. So that leads to the stigma, and it is influenced by whether you think someone is to blame and whether they have control over the behavior. When you say somebody is weak, somebody cannot control themselves, that means they have the control. They have to make the choice whether to use or not. And then the stigma decreases when it's not their fault or they cannot help it. So initially, that may be their choice when they are starting to experience with the drug use, but then they get to the point where they lose control over drug use. And that's when it's not their choice, when that's the point when drug controls them. And that is exactly the definition of addiction. It's a primary chronic brain disorder which is characterized by compulsive substance seeking behavior and use despite harmful consequences. So they know that this drug is bad for them. It's causing them to be away from their family. Some people lose their loved ones, they lose their kids. Like here in the West, it's very common. If you're using the drugs and you're neglecting childcare, your kids will be taken into the custody that we call the DFS custody. They can have legal problem. They may not be able to study their students. If they work, they may lose their jobs. So they know the consequences, but the brain is now hijacked by the drug, so they cannot control using it. And unless we see it as a medical illness and treat it from the medical illness lens, it's going to be a problem taking care of this issue. And that's why there's so much relapse rate, because we can just tell them, hey, just stop using it, you'll be fine. You won't be fine, because you have to use medication, you have to use therapy, counseling, you have to target the areas of the brain that are responsible and give them time so their brain can recover from the illness. So this is a picture that Nora Volkov, she's the director at NIDA, and she has done a lot of work in addiction. So what I want you to focus on is on the left side, two areas. I think you may be able to see my arrow. So I have the arrow pointing the VTA and NAC, which is the ventral tegmental area of the midbrain and the nucleus accumbens in the limbic cortex. This is the main area where if anything that we feel good about and that gives us pleasure, that goes through this pathway. That's where dopamine is released. So all drugs of abuse, doesn't matter which one we are talking about, they all eventually cause release of dopamine here. And then the other area I want you to look at is PFC, which is the prefrontal cortex area in red. This is the area that gives us the inhibitory control, whether something is good or not to use. And that area takes time to develop. Like suppose in 20s and 30s, people are still developing their prefrontal cortex. So what sometime you may have heard about this, the limbic cortex is being like the animal brain and the prefrontal cortex being like the more mature brain whenever we talk about it, in different scenarios too, because this is the brain that kind of gets into this flight very early, and then prefrontal will tell you whether you need to act on the situation or not, and how to restrain yourself. So when people are not using drugs, this is the normal, this is how their brains should be. The nucleus accumbens should be smaller, prefrontal should be bigger, so it can provide that inhibitory control. But unfortunately, when they start using the drugs, because our brain likes it, the drugs, they release dopamine at a very high magnitude. So suppose if you enjoy something like a good food, ice cream, nehari, whatever, it gives you a buzz of dopamine up to 200 to 300 magnitude. If someone uses methamphetamine, that's going to take it to 1000 magnitude. So that's why it's so good that people tend to go towards it and they use it more and more. So with time, what happens, this area grows. So on the right side, if you look at the green box, this is bigger now because they've been using it. And with the use, that area is growing, and that's going to take over the inhibitory control, which is the red area, which is shrinking, the prefrontal cortex. So now the animal brain is taking over, which means I want, and want. just like a hungry lion. So if they want the drugs, they want the drug. They don't care whether they're going to lose their family, their job, anything, or they have to commit a crime for that. It's not in their control. And this is exactly happening in the brain. That's why we say it's a medical illness and we need to address it so we can bring them back to the left side of the picture. What are some of the risk factors for addiction? So biological, if the parents used to have the drug problem, it is transmitted through genetics and kids have that problem. Lack of attachment and nurturing by caregivers. So initially when kids are growing up, we all grew up, when we had some disappointments, our parents were there to comfort us, to have that sort of attachment or sense of attachment with us, where if we are crying, somebody would hug us and hold us. And then when we grow up, we make those attachments, we solidify them in our brain. And when we are depressed and alone, we have those memories, and those memories help us develop the coping skills. Unfortunately, the kids who do not have the parents who can provide them help, or the ones who go through neglect, they do not develop any attachment. So when they are frustrated, then there's nothing for them to calm them down. So they look for other things outside to calm them down. And the other things, when you look out, is going to be drugs. And Dr. Zishan gives a talk on social media. We talk about the same thing. When the attachment is not good, what do? The kids go on social media to attach themselves and then get some validation for their reactions. The same thing happening. You are you have the appetite for something. You either go to social media to get it, you have unhealthy relationships, or you go to drugs and they provide you that attachment and validate things for you. Then untreated mental illness. If someone has a mental illness, and suppose somebody has ADHD, you treat ADHD with stimulants like Adderall and Ritalin, those medications. But if it's untreated, methamphetamine will do the same thing. So if a kid is in the college and they come across methamphetamine and they use it, they will feel better. When they feel better, they keep using it more and more. But the problem is now they become addicted to it. So untreated mental illness is another issue. Sometimes depression, sometimes other diseases. If they have and they try to use some drugs, they'll help them. They start using them more and more. Peer pressure is a very big reason in our colleges and in our students. So if your friends are using it, you don't want to be someone who is a social outcast, and you don't want to hang out with them and stand in the corner. You go out, hang out, and then you tend to use it too. Again, peer pressure is very important. One of the treatment for alcoholism that's most successful is Alcoholic Anonymous. What happens in it? It's all the community support group that comes together. It's the peers who come, and then together they look at each other, and that's how they get better. So there's some strength in coming together, having a social network. Unfortunately, the same network can be used for bad things too. So when it used there in that form, then people start using drugs. Psychological issues. If someone has had abuse in the past and that was not treated, then they are going to feel depressed, they're going to feel lonely, they're going to feel hurt. Same goes for trauma. And then if there is a drug that takes away the emotional pain, they start using it more and more. Social factors, isolation. People who do not have a good attachment, do not have family members, do not have friends, somebody who is divorced, somebody who is lonely. Those are some of the factors. If they do not connect themselves with others, since we are all social animals, then they feel this sense of isolation, and that can turn them towards using drugs or finding some other way to find attachment, and then they go towards drugs. Poverty is another reason. If you can't get your wishes fulfilled and you're always struggling to bring bread to the table, that stress can lead to it. And interpersonal conflicts, a lot of time you would hear people come in, I started using drugs when I was going through divorce, or I had a breakup, or something happened. Some kid would say that I never got along with my dad, and I was really sad about it and anxious about it, and I started using drugs to deal with that emotional pain. How do you recognize if someone has disease of addiction? So their sleep is a very good indicator for most of the mental illnesses, including addiction. If their sleep changes, either they're sleeping more or they're sleeping less, it's out of the normal pattern, then you should be worried and should see what's going on. Change in appetite, if they're eating more or eating less than normal. Mood swings, 1 minute they're fine, after 2 hours they're crying like crazy, or they are very agitated, they're breaking things in the house, If there are wild mood swings, it's going all over the place, then you should take a note of that. Irritable, this person who needs to be a really nice person is all the time is irritable. Sometimes people get irritable when they're overworked. Like in our field, there's a professional hazard of burnout. So a lot of people get irritable, but then we have to pay attention to it and find out what is going on. That if there's change in behavior, you have to sit down and ask that person, can we help you in any way? What are you going through? Being withdrawn, isolated, if you just pull yourself out of the social environment and you be isolated, then you tend to go towards drugs too. Suspicious behavior, somebody talks about, they feel like somebody's after them, they're being monitored. Maybe they accuse their family members, you've put poison in their food, in their drink. That should alarm you. Out of character behavior, somebody's talking very fast, they're spending a lot of money, they had a lot of money in their account and now they are broke all of a sudden. You need to pay attention to what's going on. Is it mania? Is it drug use? They start working on multiple projects. They cannot finish any project, but like doing multiple things. So they may be going through a manic phase induced by drugs. So that should be um, taken into consideration. Coming home late. So kids who are spending time outside and using drugs, they may come late. We should ask them what's going on or pay attention to that, spending more time outside, because if they use, they're intoxicated. So they need time to recover. So they're spending more and more time away from home. Track marks are when people use IV drugs, then they have like the needle marks on their arms. So if you see track marks, that's one of the signs. Drug paraphernalia, if you find some needle, foils, drug residue in their home. Sometimes people are using, they have like some, if they're snorting drugs, they will have some drug residue around their nose is red and crusty. That should also be another sign. Altered physical appearance, personal hygiene. So if they're using drug, they're not paying attention to themselves and they don't care because that doesn't register. The main focus in their life is how to get the drug, how to use it, how to get high, how to get another fix. That's all their life cycle. So their appearance may change, and that's so you need to pay attention to that. Decline in the academic work performance. Of course, I've explained it earlier. If they are not paying attention and using drug, they won't perform well. And some symptoms of the withdrawal, when they're going, when they've used it and now they're recovering from drug, there's a phase when your body is dependent on it, you go through withdrawal. So they may have tremors or shaky hands. With marijuana, it's very common that people have bloodshot eyes. So those things will also be some of the signs to investigate it further. So that was my portion of the talk, and now I'll hand it over to Dr. Abbasi. Thank you.